Classification of disinfectants. What is a disinfectant? Disinfectant is an agent that causes destruction or inhibition of growth of microorganisms on non-living surfaces. These are the classification of disinfectants. First, acids and alkalis. Acids and alkalis release H+ and OH negative ion and denature protein, potent bactericidal, except mycobacteria. Boric acid is a weak antiseptic or bacteriostatic. It doesn't irritate the skin or even delicate tissues. Boric acid should not be used liberally on open wounds and mucous membranes, as it is systematically toxic and causes vomition, diarrhea, and kidney damage. Salicylic acid has bacteriostatic, fungicidal, and keratolytic properties. It is also used as a dusting powder. Benzoic acid has bactericidal, which is below pH 5, and antifungal agent used as preservative and lop. Along with salicylic acid as Whitefield's ointment, it acts as a fungicide on skin. Acetic acid possesses bacteriostatic property. 2 to 5% solution is used as antiseptic wound dressing and to treat burn infections. 1% solution in surgical dressing, 0.25% for irrigation of urinary tract, and 2 to 5% in otitis externa. Alkalis. Alkalis is a hydroxyl ions also have antimicrobial activity. Sodium hydroxide. 25 soda I contains 94% sodium hydroxide in boiling water is widely used to kill common bacterial pathogens such as those causing foul cholera and pylorium disease. Sodium carbonate, also known as washing soda. 4% solution is used as antiseptic cleansing for wound. Calcium oxide or lime. It is easily available and cheap. It is also used as general disinfectant in farmyard by scattering in the drains or by sweeping on the floors. Excessive application on floors may cause dermal erosion and infections. Calcium hydroxide or milk of lime. Mixed with 4 volumes of water and used as disinfectant in areas contaminated with excreta. While sulfurated lime, it is a topical solution that is used as scabicide in veterinary medicine. Second, alcohols. Primary aliphatic alcohols are widely used antiseptics and disinfectants. They precipitate bacterial cytoplasmic proteins, and the effect is related to their lipid solubility. Ethyl alcohol employed as an antiseptic at 60 to 90% concentration. The antiseptic activity decreases above 90%. Some of its disadvantages are poor activity against spores, some viruses, and fungi. It is also irritant, causes burning when applied on open wounds. Alcohols are also flammable. It should be allowed to evaporate before causing cautery or laser surgery. Isopropyl alcohol. 50% of its concentration possess bactericidal action and is used as skin antiseptics. Its uses are it is used alone or in combination with iodine, phenol, and chlorhexidine. Not active in the presence of physical dirt and not recommended for surgical instruments. Third, aldehydes or reducing agents. These are used as disinfectants and they have potent germicidal properties against all microbes including spores and retain the activity even in presence of organic matter. Aldehydes has three types: formaldehyde, glutaraldehyde, and sulfur dioxide. Formaldehyde. It is an irritant and has corrosive action on the skin. The irritant vapors can be neutralized with ammonia solution. Glutaraldehyde. Chemosterilizing agent, less irritant and active against bacteria, fungi, virus, spores, and biofilms. It is better than formaldehyde for sterilizing rubber, plastic, and metal appliances. Sulfur dioxide. Its efficacy is maximum when the surface is moist as the gas dissolves in water to form sulfurous acid, which is bactericidal. It is corrosive to fabrics and metals. Fourth, surfactants. These are surface active agents, reduce surface and interfacial tension, and act as cleansing. It is emulsifying agents with antibacterial property, and they are also called as detergents. There are two types of surfactants. First is the anionic detergents or soaps. It is active in mild acid solution and includes soaps, calcium mandolate, ammonium mandolate, and sodium lauryl sulfate. Cationic detergents. It is active in alkaline medium and include quaternary ammonium compounds and dyes. Cetrimide acts as a foaming agent, while benzalkonium chloride 0.1% alcoholic solution is used for sterilization, and 0.01 to 0.05 solution is used on mucous membrane and to clean deep wounds. Fifth, phenol derivatives. These are used as antiseptics and disinfectants. They are also protoplasmic poisons and denature proteins. Phenols or carboxylic acid. Its first disinfectant and antiseptic used by Joseph Lister in 1867. Cresol or cressylic acid is an impure mixture of ortho, meta, and paramethyl derivatives of phenol and is obtained from coal tar distillation. Toxicity. Both phenol and cresol are toxic to dogs and cats, hence should not be used to disinfect the kennels or cat cages. Resorcinol. It has antimicrobial activity similar to phenol. Chlorosalinol is a broad-spectrum bactericide used for surgical antisepsis, while hexachlorophene is an odorless and non-irritating to skin. Wood tar derivative. Pine tar or antimicrobial action is due to phenol, while chlorhexidine is effective against G-positive and G-negative organisms and fungi. Sixth, halogens. These are used as topical antimicrobial agents and they bind with protoplasm, oxidize proteins, and interfere with vital metabolic functions of microbes. Chlorine is a strong oxidizing agent, oxidation of peptide links, and denaturation of protein. It is inactivated in the presence of organic matter. Chlorine has two types. First is the inorganic compound, which is unstable and releases chlorine slowly where exposed to the atmosphere or organic material. Organic derivatives, which is the chloramines T and the chlorinated lime. Chloramines T are also used to treat swimming pool and drinking water. Iodine is a potent, broad-spectrum, and rapidly acting microcidal agent. Chlorophores has two types. First is the chlorinated lime. It is obtained by action of chlorine on lime and used to disinfect drinking water. Sodium hypochlorite is a powerful disinfectant. It is usually used in dairies for milk cans. Calcium hypochlorite. It contains 2 to 5% chlorine and used as disinfectant in serious infectious diseases such as anthrax and tetanus. Seventh, oxidizing agents. These are short-acting germicides and it acts by oxidizing bacterial protoplasm. Hydrogen peroxide. These are those which release gaseous oxygen, while the halogens, these are those which cause oxidation without the release of oxygen. Hydrogen peroxide is used as an antiseptic on surface wounds and disinfectant in water treatment and for sterilization of dental and surgical instruments. Benzoyl peroxide slowly releases oxygen, oxidizing antiseptic, keratolytic and antiseboric, useful in pyoderma and dogs. Sodium perborate, white crystalline powder, decomposed in solution to give sodium metaborate and hydrogen peroxide, which in turn release nascent oxygen. Potassium permanganate. These are the dark purple crystals with metallic luster forming pink or deep purple solutions in water. Peracetic acid is recently introduced antiseptic and sterilizing agent. It is active against bacteria, fungi, and viruses. 8th, dyes. They are used as skin and wound antiseptics. They are also more active against gram-positive organisms than gram-negative organisms. Azo dyes is a scarlet red that is commonly used as urinary tract antiseptic and in combination with sulfonamides in UTIs. While acridine dyes is a non-irritating and do not retard healing. Gentian violet. It is active against Staphylococci, other G-positive bacteria and fungi, but not against G-negative bacteria and mycobacteria. Nitrofurazone. It acts by inhibiting enzymes of carbohydrate metabolism in bacteria. 9th, metallic salts. Salts of mercury, copper, and silver are used as disinfectant. Hence, organic compounds such as mercurochrome, phenylmercury nitrate, and thiomersal are used as antiseptics, which are less toxic. Mercury compounds. The inorganic mercuric dichloride is an early mercurial antiseptic replaced by less irritant and less toxic organic mercurial. Silver salts. These are microbicidal through astringent and caustic actions. Zinc salts. Sulfate or oxide are astringents, corrosive, and used as mild antiseptics in the form of powder, ointment, or lotion, while copper sulfate has astringent, fungicidal, and germicidal activities. 10th, biguanides. Biguanide is completely soluble in water. Its performance is not dependent on the pH of the water. It is stable to sunlight and elevated pool or spa water temperature. Chlorhexidine. It is a powerful non-irritating antiseptic and acts by disrupting bacterial cell membrane. Chlorhexidine gluconate is used as a general antiseptic and has been found in ointments, skin and wound cleaners, teeth dips, and shampoo. Chlorhexidine hydrochloride. It is an intermediate-level disinfectant and is a potent bactericidal agent and acts by disrupting the bacterial cell wall. EDTA is used as an irrigant in combination with antibiotics and otitis externa, bacterial rhinitis, and multiple fistula in dogs. Amphoretic compound. Amphoretic surfactant biocides have one anionic and cationic group, anionic at pH above the isoelectric point and cationic at pH below the isoelectric point or the Zwitter's ions. Shampoos equal anions and cations, hence they are balanced.